Hello guys, so good morning. So andito na tayo sa Module 9, HIS, Hospital Information Systems. I know that it might be confusing. We're studying so much HIS, but don't worry, I'll make it clear for you. So we are tackling Hospital Information System. Whether you like going to hospitals, guys, or not, hospitals are very important parts of our society. Yan. Especially guys, during this pandemic, wherein guys, your hospitals, your health professionals are basically frontliners in this war against this SARS-CoV-2. So class, hospitals are very unique and there's so much happening inside a health facility. So that's what we're going today. How would hospital information system be placed in that picture? Yeah, and how does it fit in the activities inside the hospital? So class, our objectives for the day is to identify the functions of our hospital information systems, what are its advantage, and what are the different subsystems. So class, you know, hospitals are so unique in such a way that it promotes the well-being of society. That without hospitals, class, business will not flourish, a country will not flourish if the people are sick. And class, I hope one day that you're going to be a hospital administrator. Because, just looking at this photo, ang raming minamanage. There's so many things to be managed in a hospital. Example, first, outpatient management. So the patients who are not they are not admitted inside the hospital. So usually yun, nagpa-check up lang sila. So how will you manage your outpatients? Your doctors, you have so many doctors in different department, in your emergency department, in your operating department, in your surgical department, in your pediatric department, in your obstetric department. So class, doctors are also limited resources. How are we going to manage it? Ganun. So class, today, let's get an imaginary shoe, and we're going to act as hospital administrators today. And I hope one day that you're going to be a real hospital administrator, because looking at this class, it's a very challenging task. It's a daunting task that hospital administrator must balance taking care of the patients and class, as much as possible, the hospital is also earning and could pay its bills, and could pay its people, improve its doctors, pay the janitors, the security guards, and the different helpers inside the hospitals, and the different office workers in the hospital. So class, napaka-challenging maging hospital administrator, and I hope and pray that you could be one, diba? Pwede, diba? So aim high. So what else do the things that are happening in your hospital? We have a pharmacy section. So inside that pharmacy, we have a pharmacist. We have the pathology section. Yan. So that doon tayo, class. So, medical laboratory scientists. We have the inpatient class. Once you enter the hospital, or have you tried being admitted, class? Isn't it that sometimes we have to wait a long time for our room to be vacant, diba? So, they manage this patients who are trying to be admitted, or some patient wants to be transferred to another room or another hospital. Yan, maraming nangyayari. Class, the payroll, you have to pay your workforce, the inventory, class. So from down to the cotton, to the bed sheets, to the medical equipments, the ultrasounds, the ventilators, class, we need to manage them. Maraming class. Radiology, they have so much equipment in radiology, blood bank, So they not only manage the equipments in blood banking, they also manage the blood units. Marami. Plus, just an update. So in Red Cross class, due to this pandemic, actually we're running out of blood units. Yan. So if you could donate, then please donate. We manage the records of your patients. We manage all the bills, all the payables, the front office, the front desk, all the scheduling of the patient, the registration of the patient, download centers. Where we could get the different documents from the patient, from the hospital, calendar, the ambulances, the vehicles in your hospitals, and how we communicate to other institutions. So class, ang dami. So hospitals are very important in our society. There's so many things to manage in the hospital. So we need to streamline it. We need to be efficient in our management of all of this, and as much as possible along the way we want to prevent errors. Yan. So isn't it that your homework is you're going to find common errors that happens in the hospital, and how could hospital information system mitigate, prevent these errors. Yan. So yun. So class, your health information systems, class, are very important in your hospitals. Yan. Since your hospitals, class, manages a ton of data. Yan. And class, an error can lead to patient's detriment. Yan. Pwede, hindi naman exactly death agad, but diba, it can, an error can cause the life of a patient. But yan, class. So HIS can be defined as massive integrated systems that support the comprehensive information requirements of hospitals, from inpatients to the clinical, to the ancillary, to the financial management. So class, your hospital manages so much information, and sometimes it's very sensitive. Yeah, so we need assistance in managing all this, and HIS will come into place. Yeah, so that's what we're talking about today. So class, your HIS, so as much as possible, promotes patient care and the best outcome for our patient as much as possible. But class, your HIS also is important with the administration of the hospital as a whole. Yan. So as much as possible, your inventory is in place. Yan. Your personnel are well paid and well trained. Yan. Ang daming manage class sa hospital information system. And I think we're just going to scratch the portion of it. So what are the benefits of hospital information? So class, you can read your module, but let's just have an overview. So number one, access to doctors and patients' data. So class, since the pandemic has already wreaking havoc for months now, class. Honestly, I don't want to go to hospitals, but good that we can now remotely access our doctors, and our doctors could already remotely access our files through the help of a hospital information system. What else? It improves quality of patient care. Class, it helps the doctors manage our treatment well, manage the different laboratory tests that should be done, and assist and decision support for comprehensive healthcare policies. Yan. So class, your hospital not only catered to its patient, but it also, class, participates in the surveillance of disease, especially ngayong COVID. So they assist in comprehensive healthcare policies. They help Duque decide about what are the best practices in COVID-19 right now. What else? Efficient and accurate administration of finance. What else? Diet of the patient. Engineering, class. So, in a hospital, I think you won't notice, but there are actually engineering controls wherein there should be proper ventilation, class, correct directional flow of air, so that we will not be infected through the circulating air in the hospitals. What else, class? The maintenance of its structure, ganyan. So, ang dami sa hospital class. What else? Distribution of medical aid. Your hospitals also conduct outreaches, meaning they go. So, back then, before COVID, they go to different barangays and help out. Yan. So, they make medical outreaches. What else, class? Improve monitoring of drugs. Yan. Study its effectiveness or therapeutic drug monitoring. Yan. I missed my teacher, sabi niya, therapeutic. Pag nagde-discuss siya, the therapeutic use. Next, improve quality of documentation. So class, gone are the days that they need to write down everything, class. Because sometimes some nurses, some clerks miss out information. Enhances information integrity. It reduces transcription errors, reduces duplications. What else? Easy to use and eliminates error caused by handwriting. So, class, ang maraming benefits ng hospital information system. At ano lang to, class, this is just an overview. Yan. So, class, your hospital information system have different uses for the different workers in the hospital. So, class, for security's sake, your nurses cannot access every information in our hospital information. Same thing with your physicians. Same thing with your registration clerks. Due to safety reasons and privacy, class. So there are just limited data na kaya nilang i-access. What does that mean? So they can only access the things that they should use. Example, as a medical laboratory scientist or an allied health professional, I could only access the laboratory results, the patient's demographic. Other than that, other information in the hospital information system, I could not access for security reasons. Same thing with your nurses. They could not access what I could access in the laboratory. Yan. So unless I allow them to see the laboratory results, that's the thing that they could see. Yan. So class, due to security reasons, yan. So there are only limited data that a health worker could access in the hospital information system. Example, in the accounting area, so they could only access the accounts of patients, insurance policies, and the like. So they cannot access the other data like treatment management, something like that. So class, your HIS have different uses to your health workers. So let's start with your physicians. So your physicians could use the CPOE, Computerized Provider Order Entry. So all the instructions from the treatment to the diagnosis, kung gusto niya magpa-ultrasound, isa-schedule na nung HIS natin if the doctor wants the patient to have MRI or go to dialysis, yan, it will all be scheduled using your CPOE. Yan. So it improves the accuracy and legibility so that your pharmacy could read the patient medications, the clinician's efficiency and effectiveness, so they have real-time access to the current allergies of the patients, to the current symptoms of the patients. They could have access to the best practice information yung mga physicians. So our physician class do not know it all. So sometimes they need to Google it. They need some references for the best practices. And since class health information is varying every time, especially the treatment on COVID-19 class. Improves care through logging of all orders, reduces medication error rate. Yan. So for our nurses, it will allow the access to orders and results. So class, basically your nurses are the assistants of the physicians. You know, your nurses works very hard Class, I work with them. They work very hard. Some nurses are even smarter than doctors, class. Sa ganyang kagaling ang mga nurses natin. So, they will decrease the need for paper, decrease errors, increase the patient safety. So, class, your nurses are in charge for giving the medications and giving the IV. So, I think at least they could check yan, if it's already time for the medication. They check if all the test results came in already. So test from X-ray, test of your fasting blood sugar, test from your sabihin natin blood gas from the respiratory therapist. Yan. So the nurse will check if all the diagnostic tests came in. Yan. Yung naming function class ng mga nurses. Allied health professionals, so our pharmacists, our radio technologists, our respiratory therapists, and medical laboratory scientists. So we could access the patient demographics, what medication are they in, because it could affect our test results. Yan, what else? Yan, meron medications. What else? Yan, increase the patient safety. And class ward and registration clerks. Yeah. So they strengthen internal and external communication among healthcare providers, decrease the need for re-registrations and duplications of registration. That's it, class. Yan. So, class overview of the application of hospital information system. So, class, I like this table. So, ang dali malaman ng function ng HIS or application. So, first column is the business application. So, the business side. So, class, your hospital is also a organization or has a business portion. Yan. So, that is what is unique about your hospitals. And class, we have clinical application. So let's talk about your business application. Accounting. So what is accounting? So your HIS facilitates the process of preparing results about the management of your hospital, class. So nagpre-prepare ng mga ledger, accounts payable, about their assets, what's the revenue for the month, the billing. Yan. So your accounting is very important. So it helps managers to make short-term and long-term decisions. So your HIS facilitates the management of income and expenses, basically. And class personal management. So paano tumutulong? How does HIS help? It facilitates the hiring, the developing, the compensation, or the payroll of the employees who are on leave, aims to recruit and retain the quality workforce for the hospital to meet its goals. So class, not only from physicians, but also our technicians, our ambulance drivers. There's so many workers that are needed in your hospital. So as much as possible, we want them to be satisfied, and we want to know what is their work schedule, and we want to train them. So there's so much going on under personnel management. So to manage it well, we could need a hospital information system. Class, next, inventory management. So there's so many things in the hospital, just like your beds, your rooms, isn't it? Your OR. Class, these are all limited resources. Our, ano pa ba? Yung ambulances natin, class. So, request for quotations and proposals, our equipments, organize and track. So, your HIS facilitates the organization and tracking of all the goods in the hospitals and assets. We make sure that all the stocks, example, the medicines, the vaccines, are the correct stock or the correct brand. They are at the right levels. Example, yung PPE natin, class, they are in the right place at the right time, at the right cost. Yan. So, class, grabe yung mga nasa inventory, class. And what else I will discuss? This fleet management. So fleet management are the management of vehicles in an organization. So example, the ambulances of the hospital, and they need to manage it. So we also have budgeting, planning, prescription, and medication administration. So class, some medications are actually locked. Yan, they are very limited kasi they are very prone to abuse. Yung mga morphine, opioids, image storing and management, dietary class, the food in the dietary, minamanage yun. Housekeeping and laundry class, they count yung mga punda, ancillary requests, repertory. Okay, we're back. So here now, we are on clinical application of your HIS. So your HIS facilitates the registration of your patient. So basically, this is your the check-in of your patient. So we prevent long waiting time of your patients to be admitted. So yan, it will facilitate it. We have the management of your patient charts, from the doctor's notes to the nurse's notes to the orders of the diagnostic test, of the medication or the treatment, mga physical therapy treatment, all are in your patient charts, medication. Now, class, we have also laboratory information system. So next week, we're going to learn about management of your specimens, how we track orders, how we manage our results, our radiology information systems, and PACS, order tracking, results management, management of your operating room or theater, automated schedule management, schedule of your doctors, utilization management, and peri-operative management. So when we say peri-operative management, so the times, which is the time of the management of the time of the time around the patient surgery. Yan. So, yan, class. So, before surgery, after surgery, and during surgery. Yan. So, we manage our patient. Manage a patient around. Ano ba yan? Anyway. So, class, components of a hospital information system. So, this is just an overview. So, the registration, order entry, and results reporting. I think I mentioned already that the documentation. So every time the doctor encounters your patient, so he has notes, our scheduling, our billing. So everything, class, is paid by the patient, from the gloves of the nurses to the PPE, through the cotton, the gauzes that are used in surgery, class. So yun, lahat, the anesthesia, ayun, lahat binabayaran ng pasyente. So the different subsystems of your HIS, so we have this PACS, Picture Archiving Communication System. So all the images that are required during your time in the hospital. So yun, may X-ray, CT scans, MRI, ECGs. We will learn about those. Radiology information system, and so on. Yan, ang daming subsystems. So class, here are just examples of HIS providers in the Philippines. Yan. So class, I search the HOMIS. May I pala siya, I-HOMIS. So integrate, I means integrated hospital operation management information system. We have ComLogic and BizBox. Class, I'll share a couple of videos. So if you have time, please scan it. So class, as a summary, so your HIS is very important. Your hospital information system is very important. It manages so many departments in the hospital. I think I showed this image because I think I did not mention this. TPA, third party administrator. So your hospitals also have memorandums of agreement with your insurance companies, with your PhilHealth, ganyan. So, yan, meron rin to manage those administrators. So, meron tayong TPA, finance and accounting, the HR or the personnel management, the OPD, the inpatient. So, plus ang daming minamanage sa hospital. And this is just an overview. So, ayan, to promote patient safety, to provide quality healthcare. So your HIS is very important to assist with that. So guys, thank you for listening, and I'll see you next time.